Bismillahirrahmanirrahim. I'm Dr. Hena Mazhar, and this is the second presentation of this series of talks about the basic dermoscopy. The first lecture was about the importance of learning dermoscopy. In the slides to come, we'll learn the basic physics and types of the dermatoscope. Right, what is dermoscopy? Dermoscopy or epiluminance microscopy is a simple, non-invasive method to examine the subsurface features of the skin. And what is the dermoscope? It's a non-invasive diagnostic tool which visualizes subtle clinical patterns of skin lesions and subsurface skin structures not normally visible to the unaided eye. It has also been called a skin surface microscope, epiluminance microscope, or an episcope. With the help of this handy tool, we can see the epidermis, dermoepidermal junction, and superficial dermis, or even up to mid-dermis. There are three different types of dermatoscope: the non-polarized devices, polarized devices, and the hybrid ones, which have the option of toggling between the non-polarized and the polarized mode. Okay, let's study the physics of dermoscopy. Natural light, when incident on an object, is either reflected or absorbed or scattered. Light incident on the skin surface, most of it is reflected back. Why? I'll show you next. Okay, let's consider this is stratum corneum, epidermis, and then this is dermis. Most of the light incident on the skin surface gets reflected back. Why? Because the refractive index of skin is 1.55, while the refractive index of air is just 1. So because of this difference in the refractive index, most of the light striking the skin surface gets reflected back. This phenomena is called glare or specular reflectance. Same happens when you visualize the skin surface with the help of a magnifying glass. Most of the light incident on the skin surface just gets reflected back, and hence you are able to see only the skin surface, only the stratum corneum, even with the help of very high power lenses. To visualize the deeper skin structures, this specular reflectance or this glare has to be reduced. And how it happens? In the non-polarized dermoscopy, this is achieved by using this glass plate. In order to use this glare or specular reflectance, let's see, this is the stratum corneum. We use a glass plate. The refractive index of this glass plate is 1.52. We also use an interface fluid between the glass plate and the skin surface, and the refractive index of this interface fluid should be equal to that of the stratum corneum. Now, when the light passes through this glass plate, it gets deeper into the epidermis and then reflects back. So in this way, with the help of a non-polarized dermoscopy, you can see the epidermis, mid or even the deeper epidermis. Polarized dermatoscopes use polarized light and are developed on the principle of cross-polarization. So what happens? Normally, this natural light, it vibrates in different directions, right? But the polarized light vibrates only in one direction. In the polarized dermoscopy, we use two polarizers, and these two polarizers are held orthogonally at 90 degrees to each other. When light is passed through this polarizer, it only vibrates in just one direction. All the light waves which are vibrating in other directions are blocked. This specular reflectance reduction is also achieved by a technology called polarized dermoscopy. These polarizers are widely used in the field of photography to reduce glare. If this is the stratum corneum, then epidermis, and then dermis, this utilizes two filters held orthogonally at 90 degrees to each other. Polarized light incident to the stratum corneum is partly reflected from the skin surface, and the rest enters the skin. The part which is reflected from the skin surface maintains its polarization, while the part which penetrates deeper loses its polarity. Now, this second filter, which is held at 90 degrees to the first filter, this blocks the reflected polarized light and allows the light from the deeper layers to pass through it, which has lost its polarity. The polarized light penetrates 60 to 100 micrometers deep into the skin surface, and hence this part of the dermis is visualized. This technology, which allows the light which has lost its polarization to pass through the second filter, whereas blocking the light which maintains its polarization, is known as cross polarization. The modalities which can be used for dermoscopy are the contact method and the non-contact method. Non-polarized dermoscopy is always contact. I have just explained you the physics behind it. While the polarized dermoscopy can be contact or non-contact depending on the provision of the non-contact method in your device. As I explained before, you should always use the immersion fluid with non-polarized dermoscopy. This immersion fluid can be either alcohol or gel or water or maybe mineral oil. So the main difference between the non-polarized and polarized dermoscopy is the use of liquid interface with contact method for non-polarized dermoscopy, while the contact or non-contact both options for polarized dermoscopy. With the help of a non-polarized dermatoscope, you can see the superficial layers, that is epidermis, while with the help of a polarized dermatoscope, you can see the deeper layers of epidermis and up to papillary dermis. Right. This is an image of seborrheic keratosis in non-polarized dermoscopy. If you look closely, you will be able to appreciate these very small white clots, shiny white structures which are called milia-like cysts. This is a characteristic feature of seborrheic keratosis in non-polarized dermoscopy. These milia-like cysts are formed by the keratin pearls in the top layers of epidermis. I just explained that the non-polarized mode visualizes the epidermal structures more clearly. This is the same lesion under the polarized dermoscopy, and these white structures are not as clearly visible as in the non-polarized mode. You will be able to appreciate this difference more if you toggle between the non-polarized and polarized mode. Again, non-polarized and polarized mode. You see, these milia-like cysts are more clearly visible in the non-polarized mode as compared to the polarized mode. So, milia-like cysts or the epidermal structures are more clearly visible in the non-polarized dermoscopy. This is an image of a melanoma showing blue-white veil on non-polarized dermoscopy. This blue-white veil is confluent blue pigmentation with an overlying white ground glass haze. Histopathologically, this dermoscopic structure corresponds to an aggregation of heavily pigmented cells, melanocytes or nests of melanocytes, or melanin in the dermis, which gives blue color, in combination with compact orthokeratosis. In melanoma, the blue-white veil is non-uniform in color and is present focally within the lesion. In contrast, this blue-white veil has a uniform steel blue color in blue nevi, and it occupies the entire surface area of the lesion. If you see the same structure under the polarized dermoscope, the same lesion under the polarized dermoscope, you will see these shiny white lines, which are the crystalline structures, which appear as shiny white lines or shiny white streaks that are seen under the polarized dermoscopy only, but not under the non-polarized dermoscopy. The white streaks are oriented parallel or sometimes perpendicular to each other. These structures correlate histopathologically with altered collagen in the dermis. The birefringent property of the collagen bundles cause rapid randomization of polarized light. This is the reason this collagen appears bright white and more prominent under the polarized dermoscopy. So, the orthokeratosis, which is the hyperkeratosis of the top layers of epidermis, is seen more prominently in the non-polarized dermoscopy as expected, while this altered collagen, which is deep in the dermis, is seen more prominently under the polarized dermoscopy. You can appreciate this difference more if you will toggle between the polarized and non-polarized mode. Like this is non-polarized, and blue-white veil is more prominent here, while in polarized light that blue-white veil is all gone, that haze is all gone, and you can see these shiny white lines. Again, non-polarized blue-white veil and polarized with shiny white lines. Non-polarized and polarized dermoscopy. This is the dermoscopic image of a blue nevus. In non-polarized dermoscopy, it gives more a steel blue color, while in the polarized dermoscopy, blue hues are more prominent because the nevus cells are found deep in the dermis, and in polarized dermoscopy, we are seeing mainly the dermis. Again, non-polarized dermoscopy, steel blue color, more blue hues in the polarized dermoscopy. Non-polarized, polarized. Again, non-polarized and polarized dermoscopy. This is the dermoscopic image of a pigmented BCC in the non-polarized dermoscopy. If you see here, there is a haze, some pigmented structures, ovoidness, dots, few globules, maple leaf-like areas. And if you concentrate here, there is a flush, a vascular flush, which is not very prominent. If you see the same lesion under the polarized light, then this vascular flush is way more prominent. Can you notice something else as well? These shiny white areas, shiny white structures, which I showed you in the previous image. Again, because of altered collagen, this is very prominent here, and it was not prominent in the non-polarized mode. I'll show you again. The non-polarized dermoscopy and the polarized mode. So this vascular flush is more prominent here, and these shiny white lines are more prominent here. Again, the gray ovoid nests, again, they are more prominent in the polarized dermoscopy. So non-polarized mode and again the polarized mode. Non-polarized and polarized. So this vascular flush, which is deep in the dermis, is more prominent in the polarized dermoscopy. And as I told you previously, these shiny white lines, which are due to the altered collagen, are again more prominent in the polarized dermoscopy. Again, in the non-polarized dermoscopy, you can't see much in this image, but in polarized dermoscopy, you can see these vascular structures, which are way more prominent than in the polarized non-polarized mode. And you can also see these shiny white, very fine shiny white structures, shiny white lines. If you will toggle again between the non-polarized and polarized mode, non-polarized and polarized mode, you will be able to appreciate more that these shiny white lines and vascular structures are more prominent in the polarized mode rather than the non-polarized mode. So, to summarize, the steel blue color, blue-white veil, and myelin-like cysts, which are the epidermal structures, are more prominent in the non-polarized dermoscopy, while the shiny white lines, blue hues, and vascular structures are more prominent in the polarized dermoscopy. Again, the comparison of both. The ability to visualize the vascular structures is dependent upon the amount of pressure applied to the skin. This is the non-contact polarized dermoscopy, and you can see the vascular flush here. But with the same polarized dermoscopy in contact mode, with this pressure, the area in the center is all blanched. So the vascular structures are more prominent if you apply less pressure on the skin. This video will clarify this concept of compression effect more. This is an SCC with prominent vessels on the periphery. Look at these vessels and these vessels. If you look closely here and here, these vessels, they get blanched when pressure is applied on the lesion while doing the contact dermoscopy. There are so many uses of dermoscopy in dermatology. It can be used for evaluation of pigmented and non-pigmented skin lesions, for entomodermoscopy, which is the evaluation of skin infestations by the help of this dermatoscope, trichoscopy to see the hair, onychoscopy for nails, inflammoscopy for inflammatory skin lesions, for evaluation of mucosal lesions in aesthetics, and in fact, on every patient with a skin lesion, you can do dermoscopy. What do you need for dermoscopy? Definitely a good dermatoscope. This is Termlite DL4, my personal favorite. This is a hybrid device. This is Termlite DL200, again a hybrid device. This is Termlite DL200HR, and this is Termlite DL100. Both these are the polarized dermatoscopes. Molescope, a non-polarized device. Molescope 2, a polarized device. Heine again has very good dermatoscopes, Delta 220T and Delta 1. Then there are a few more devices which can be used for photography only. And this is the smartphone adapter. This is a universal adapter. You can attach any smartphone with this adapter. Termlight and Heine are very big names in the field of dermoscopy, and your choice of dermoscope depends on your budget, your interest, or your digital imaging choices. You can choose the dermatoscope which is polarized, unpolarized, or hybrid. I would suggest you to get a device which has both polarized and unpolarized mode, because few skin lesions you can see better with the polarized mode, while other skin lesions you can see better with the non-polarized mode. Then choice of option of contact or non-contact dermoscopy, then ability to attach a camera, lens size and quality, usually 30 millimeter is a good size lens, then portability, pigment boost effects. Some dermatoscopes give this option of pigment boost effect for melanocytic lesions, and then charging options. Few dermatoscopes come with this heavy dock chargers, which is not very easy to carry along with you, while other dermatoscopes they come with they just get charged with the USB type C or the mini USB cables, data cables. What else do you need? Obviously training, option of clinical photography, second opinion by someone who is more expert in dermoscopy than you, and plenty of practice. Practice makes man perfect. Okay, time for a short break. In the next lecture, we'll discuss the basic terminology used in dermoscopy. Thank you for patient listening. See you later.